So what I found most positive is that the discussion of scaling up is very broadly framed, and there are distinctions made between the different types of scaling up, and that scaling up more generally is put and discussed within the broader context of health systems that are changing, and that the focus of innovation in health systems change has been very much emphasized, and that the group has very clearly gone beyond the parameters of the existing health system and said we must look more broadly, we must look at the non-conventional sector, the informal sector, the private sector. I think that has been immensely creative and stimulating. I also thought it was very important and strategic that along the way people talked about scaling up and how it affects capacity and capacity building. And we saw some interesting examples of how scaling up and the introduction of innovations can really build capacity in multiple areas. But at the same time, there remains the question as to whether the emphasis on new things can really crowd out the old things, which also should continue to get attention. And then I wanted to say that two other things were very important, because in the work that ExpandNet has done and my colleagues have done early on the strategic approach has always been that we must bring in multiple stakeholders or actors, and that includes not just policymakers from different areas or researchers from different areas, but that means bringing in local people and listening to local people so that one can have a bottom-up perspective, while at the same time proceeding very scientifically and systematically in a larger context. Very pleased when the blueprint approach is clearly stated as dysfunctional and not working, because in the environments that I work in, often there's still a lot of people who really do think that they have blueprints that they can simply give to countries and implement them. So I think that's it. It's been a very constructive, very good meeting, and in a very interesting institution.